Okay, guys. So, good morning once again. This is MJ Bautista, and today I'll be sharing with you a PowerPoint presentation that was created to Walters Kluwer, Lippincott, Williams, and Wilkins. So, we're going to talk about the kinesiology and biomechanics. This is just an introduction of your course in anatomy and kinesiology. So, to start with, we're going to start with the introduction, the anatomical terminologies, kinesiology, the body system conditions, and a little about what is biomechanics. So the anatomical terms of this are the number one is a kinesiology. This is the study of human movement, wherein anatomy is a study of its structure, and biomechanics is a study of the effects of external factors on movement of living creatures, while body mechanics, efficient and effective use of body while performing message. So the anatomical terminologies use anatomical position. This is the standing position wherein you can see the palm of the hands facing front, feet and shoulders width apart. This is the anatomical position, palms facing forward, used as reference when describing the location and body structure. Okay, so moving forward, these are the planes of divisions. So letter pictures A, B, and C. The frontal or the coronal plane. This is the frontal part of our body. And then the division of halves, which is what you call the sagittal, which is the second one. And then the third one is the transverse or the horizontal, which divides the body from the superior and inferior, or the upper and the lower portion. So the directional terms that are being used, like for example, this is a sample table wherein the terms describe definition and an example. So when you say anterior, anterior is the front side of body, which is the nose, which is the anterior to your ear. Deep, more internal, deeper into the body, such as the lungs, deep to ribs. Distal, farthest or the farther from attachment points, fingers, which is distal to elbow or farther to the elbow. And then the inferior, which is the lower or towards the feet, the xiphoid process, inferior to the sternal notch. And then the lateral, which is the farther away from the midline of your body, which is the ear, lateral to your eye. So the ear is lateral to the eye, which is the lateral in terms. Medial, which is closer to midline, the eye medial to ear. Posterior, back side of the body, the spine, posterior to sternum. And then the proximal, closer to attach point, the knee proximal to ankle. And then the superficial, which is the closer to the surface of the skin, skin superficial to muscles. And then superior, which is the higher or toward the head, nose superior to your navel. So this is the directional terms that is being used. So this is the anterior, the ventral, and the dorsal. When you are standing in an anatomical position, so the inferior, which you call the caudal, to the lower part of your body, which is your lower down to your foot, and then the superior, which is the cranial or the upper portion. So here is the distal and the proximal, and the anterior is the front and the back, which is front, which is the anterior ventral, and the posterior dorsal. Then here on the smaller image of this human, which is medial, and then the lateral. So this is the directional terms used in anatomy. So this is what you call the anterior body regions. So the superior, this is the cephalic, or what we call the head, the cranium or the cranial, and the facial or your face. Then thoracic, the brachial, which is on the upper arm and the lower arm, or the upper extremities, which is the antebrachial, or what you call the forehead, and then the carpal, which is the wrist. And then the femoral thigh, so the lower extremities, the upper extremities, and the cephalic or the head portion. So moving on, the posterior body, which is backward position in facing up back or away from front. We have the scapular, which is the two blades of the back of your shoulders, in the iliac or the popliteal. And then this is the occipital, which is part of your skull. and then the cervical, which starts the spine, the location of your spine, the upper portion of your spine. The deltoid is the most likely with which will be the muscular area, where usually this gives to children with for vaccinations. So brachial, which is your arm, usually the biceps and the triceps are here. Lumbar, which is the back portion of your spine, and then the sacral, which is the most likely to be the lower part of your spinal column. And then the gluteal, both gluteal or what you call the local term as buttocks. And the popliteal, this is the back of your knees, and then the tarsal, which is on the lower portion of your body or the inferior. Now, when you say kinesiology, we're going to talk about the joints. These are the mechanical structure where neighboring bones are connected with connective tissues and cartilages. Then the passive structures that allows the movement to occur, of course, because of the muscles that are being joined by your for the skeletal system, wherein there is the movement that occurs. Provide stability and shock absorption. So there is a necessary for vitamins and nutrition to maintain the stability of your body and the fluidity of your movements. So the types of joint by amount of movement allowed, the synarthrotic, which is nearly immovable or fibrous skull structures, sutures. So this is on the cranial portion of your head. So amphioarthrotic, the slightly movable, cartilaginous, the pubis symphysis in between the vertebrae of your body. In the diarthrotic, which is the synovial, freely movable joints, capsules with synovial fluids such as the shoulders, hip, knee, and elbow. So this is what you call diarthrotic, which are very common in movements. So those joints that don't require movement, this includes in the skull structures and so on and so forth. The kinesiology, the components of the arthrotic synovial joints, these are articular cartilage, bursae, joint capsule, joint cavity, the ligaments, and the synovial membranes. So what are the different types of joints? So you're going to learn more further this. The ball and socket, this allows the movement in all directions, particularly your shoulders and hip joints. So the type of joints here is what you call ball and socket. And the condyloid, which allows movement in two planes, the metacarpals or the phalanges in your arms, in your hands. Gliding, bone slides pass each other side to side between the carpals or between the tarsals, carpals and the tarsals. The hinge allows the movement in one plane. This is your elbow and the knee joint. Then the pivot allows rotation movement between your C1 or the cervical spine, C1. So you can do the pivot. C1, C2, the range between the radius and the ulnar. Then we have the saddle, allows movement in many directions. The carpo-metacarpal joints of your thumb. So next, the range of motion, amount of movement that occurs at the joint. We have the normal range of motion, the distance and directions a joint can sustain without damage to surrounding tissues. Then we have active range of motion. The client actively moves own joints. Passive range of motion, these are the therapist move joints. Client's joint, passive range of motions wherein the other person is doing that motion. And then the resisted range of motion, these are client moves joints while the therapist will assist. So the client will move and the physiotherapist will do also in assisting. So these are usually in the rehabilitation process. So myology, the study of the muscles, since anatomy and kinesiology tackles more of the skeletal and the muscular system among all organs, no, because these are probably because of the movements that are being prioritized. So nerve supply to the muscles, the cervical, brachial, lumbar, and the sacral plexuses. Neuromuscular junctions, and then also the ATPs, the direct phosphorylations, anaerobic cellular respiration, then the aerobic respiration, and the proprioreceptors. So don't worry, we're going to go further with this. And then this is the mechanisms of our ATP. the conversion or the aerobic respiration is respiration, which produces the carbon dioxide and the water. This is a form of respiration in the exchange of gases. Then this here is the glucose, which converts to pyruvic, then the fatty acids, and then the fatty acids then converted to carbon dioxide, water, and the ATP. And then another form, which is the glycogen or the glucose, or what you call the simple term as sugar. These can be converted from glycogen to glucose, glucose to pyruvic, then pyruvic to lactic acid. So without oxygen, there is an increase in lactic acid, so there is more prone for some athletes to develop some muscle cramps and spasm. So this is an aerobic mechanism wherein glycolysis is the other form of lactic acids in the absence of oxygen. So oxygen is therefore necessary whenever you go for a training program that improves your respiratory system, and then with the exchange of the mechanism in order for you to prevent lactic acids, for you to have good consumption of oxygen. And then the direct phosphorylation of ADP by reaction with creatine phosphase. So the creatinine is also one of the factors from ADP to ATP CP to creatine. So the types of fibers that are being used, as we all know, is a slow twitch fiber. These are small, red, and aerobic. These are slow to contract, less powerful, but then this gives you to a long duration. So like for example, if you're going to a marathon play, so the slow twitch takes effect more, while the fast twitch on the other hand are the anaerobic, which doesn't require much oxygen. So contract quickly and powerfully in short bursts, like for example when you are doing the lifting a heavy object, when you do a certain activity. So this requires for the fast twitch. We have type 2A, these are pink and slightly large than slow twitch fibers, and then 2X, which is the white, there's no blood supply, or what you call the largest fibers. So when you say anaerobic, you don't need to have much oxygen in it. Unlike in the aerobic, there's necessary for you to have this oxygen consumption. Then the skeletal muscle activities, this is a static contractions, which is the isometric, and then dynamic contraction, which is concentric and eccentric. Extreme conditions, atrophy and hypertrophy, and the tetany. So these are the extreme conditions that may happen to your muscles, like for example atrophy. Atrophy meaning there is a decreased tense and atrophied flow contraction of your muscles. Like for example, if you happen to have some disabilities, so therefore your muscles will atrophy. And then hypertrophy also meaning that your muscles will go to enlarge, and the tetany also, this is another condition that may be relevant to a certain disease. Then the types of contractions, we have movements A, B, and C. So the muscle contract but does not shorten. So no movement is being applied. And letter B, the muscle contracts and shortens. So as you observe, there is already an increase in the muscles of your biceps. And then the muscle contracts and lengthens as you do the extension. So next one is the muscle movement coordination, which are the prime movers, or what you call the synergies. Fixators, the stabilizers or the supporters, and the antagonists are the effects of exercise on muscles and the effects of stretching on muscles. So usually this is the extension and exertions. So the body movements also, we have the flexion and extension, abduction, adduction. These are mostly terms used only in physical education 101, which is the very basic of physical education. So the horizontal abduction, adduction, lateral flexion, left and right, lateral mediation or the rotation, and then upward and downward rotation or the circumflexion. We also have the opposition, lateral deviation, plantar or dorsiflexion, which can be done by your lower extremities or particularly your feet or footwork. Inversion and inversion are only, you can also do this by using your foot movement, inversion and extension. Elevation and depression, protraction and retraction. pronation, and supination. Inhalation and exhalation, of course, is a very basic. So biomechanics, the components of good body mechanics, which is efficient structural alignment, like for example, when you are leaning forward and lifting a certain object. Symmetrical stance, asymmetric stance, or the ergonomics, which are being used by some equipments or workspace design. So this is an example of a woman who is standing in a position wherein probably this is a health professional who is doing the movement or pulling a certain bedsheet or a certain patient, wherein the woman is standing in lunge position or bending the lower extremities in order to prevent back injury or fracture from the spinal column. And then asymmetric stance, and whenever you're going to stand in this position, you're doing some motion using your upper portion of your body. Sitting on a chair, which you do the movement wherein you need to conserve your energy, doing the movement while in a sitting position. Then the next one, body awareness. So am I using my whole body effectively and efficiently? So there is a straight line formed from the head, hips, in the back foot. This is very necessary whenever you are applying forces, whenever you are doing some work. So are my hips and front foot facing my work? Or am I doing the motion in an opposite direction, which can hinder the skeletal structure of my body, which can lead to fracture, sprains, or strains. So are my wrists and hands, shoulders relaxed whenever I do certain movement? Are my joints hyperextended? Am I breathing the right way? Does my body hurt anywhere? Okay, so this is very important, not only in sports and physical activities, but also for personal awareness, in order for them to prevent some injury, fractures concerning about their movement. So improper body mechanics, meaning to say the body areas are prone to injury. So if you're not conscious about your body movement, so therefore there is an increase of muscle injury, skeletal or bone fractures. So neck and shoulders are most of the areas that are very prone to injuries, like neck and shoulders, wrist, hands, most especially back, knees, and ankles. So these are most common injuries that are usually experienced by some of the sports players, athletes, or even doing physical activity. So improper body mechanics may lead to injuries. So in order for you to prevent this, you need to do stretching before and between sessions. So that's why the warm up is very important in doing such exercises. And then, are you doing the breathing, inhalation, and exhalation properly? Are you relaxed whenever you're doing this certain movement or motion? Stretch slowly to avoid the stretch reflex, and hold the stretch for at least 10 seconds to trigger the tendon reflex, which comfortably enhances the stretch. So next one is injury prevention. What are the guidelines in this? The consistently use all components of good body mechanics. Rest body and hands by scheduling clients or your athletes for 15 minutes apart. Stretch before and after massage session. Use proper table height. Make sure that you have plenty of room to move tables, and use variety of techniques. And be cautious with application to sustain pressure. Increase physical fitness and endurance. And of course, sleep and rest is very important. So learn body mechanics in classroom for your own instructor. Practice concept of good body mechanics outside the classroom, not only for this certain course, but as an application for your daily activity. Adopt working stances that minimize stress for your body, and practice body awareness to find the proper stance. So anyway, so guys, this is just an introduction of anatomy and kinesiology, or particularly the biomechanics. So thank you so much for listening, and I hope that you're going to study this course more and understand each of its terminologies. So thank you so much for watching, and I hope to see you soon. Bye.